future of healthcare may look like the past.
What brings you in today?
A family doctor you can rely on and get an appointment with. After a decade working at a large health system in New Jersey with as many as 1,500 patients under his care, Dr. Frank Aliganga says he was among the more than 40% of primary care physicians reporting burnout. How much time did you actually spend face-to-face with the patient?
For me, I would say 15 to 20 minutes. I tend to...
And you were supposed to spend how long?
I think to survive, you have to spend 7 minutes.
How do you know anyone's condition in 7 minutes?
You can't, you end up becoming data entry clerk and customer service.
The pressure.
Yeah, so what's been happening in our healthcare system, and this is the thing that I've been trying to tell y'all monkey behinds, what's been happening in our healthcare system is that they're slowly trying to make it like Canada. In Canada, you don't even really see a primary care physician anymore.
First of all, shout out to Anton Daniels here. I've reacted to his videos before, just one video, but this guy is putting out some serious content and you guys need to subscribe. In fact, let me subscribe now and like this video. I'm gonna like that real quick. Yep, so I need you to go watch the rest of this video and I'll react a little bit more to it, but this is the future of healthcare as I see it. Now, Anton said it's about to look like Canada. I agree, but also it's going to have an American flavor to it. This means that everything is going to go personal brand. So whichever caregiver or doctor has the best personal brand on the market is going to win the patient's attention and money, because everything is about to fall apart in the healthcare system. But as things are falling apart, they're going to shift to favor those that are, have the best personal brand. America's strange because we're already in a gig economy and we're already, in this mindset where everybody is sort of, trying to build a personal brand. Content creators are getting big now. So as long as you have a personal brand, you are going to attract, patients, because the healthcare system is completely broken. And it's not working, it's not serving anybody. Insurance is not working for anybody, it's not serving for anybody. So what I'm suspecting the government is going to do is it's going to deregulate a lot. Especially the current government, they're going to look to deregulate a lot of things so that a bunch of guys get rich out here.
Most of the time, you don't get preventative care maintenance, you don't get monthly checkups. If they just so happen to get a doctor in your particular area, the wait could be a year. They'll be waiting at the door just to get an appointment to see a primary care physician. And then they only see you for 2 or 3 minutes. They ask you some questions, get the doctor to prescribe you some stuff, and then walk out the door and go and see another person.
I think we're entering a new phase of capitalism, which is, I guess what I'm trying to say is, this is probably a new version of capitalism we've never seen before. But it will favor those that know how to operate in this new market. And I explained to you in the end, what I'm talking about.
That's literally what happens. And so that is what's happening over here in the United States of America. That's why when you schedule a doctor's appointment, it takes so long, or you got to schedule it 2 and 3 and 4 months out.
The U.S. economy is so efficient. The U.S. market is so efficient that if these kind of delays happen, somebody's going to look for a solution to reduce the wait times. So instead of you waiting months or whatever, some guy who wants to make money right away, he's going to figure out a way, to serve customers faster and better. That's capitalism. Wherever the best value is going to be built is where the money is going to flow.
And so what most primary care physicians and doctors are doing is they are moving away from an insurance-based business. The first person that I ever heard talk about it before was a Black woman. And this was years ago. And I think I heard her on social media talking about it. And she said, yes, guys, I am this kind of doctor or whatever, but I do not any longer accept insurance. I only do direct care. She said, I only do direct care. And I said, what? And because I was so ignorant and because I was so dumb, similar to the conversation that I was having with y'all the other day, I didn't do my research. So I was listening to her and it sparked my curiosity because that is the stuff that I find interesting. And so I did my research and I'm listening to her. And so she only takes on a certain amount of clients on a monthly basis, and most of them is direct primary care, meaning that they come to you, or she only works with certain people and certain families. And then when she gets to a certain threshold, you got to get on a waiting list for somebody else to leave in order for you to get in there.
I hope you guys understood what he just said. Let me clarify. What he's saying is a doctor like this one and many others are just deciding not to work with insurance companies because they see, the mess that's happening in there. This guy is being reduced to a data entry clerk. He doesn't want to do that. He's a doctor. He wants to serve his patients. So instead of him being, consumed by entering data, filing claims with insurance, by the way, that's the other thing. Medicare is going to give you a hard time trying to file claims. So instead of him wasting all his time, he will just rather find patients in the marketplace that are willing to pay him a subscription, a monthly subscription. I don't know what he's charging. Now he's in charge of everything now, collecting the money directly from the customer, whoever is willing to pay him directly. And he works with them, maybe a handful, maybe just 5. So if you have 5 patients where he comes to your house, it's the old school. He comes to your house, I think Anton talked about this, where he comes to your house and takes care of you, checks, kind of like the old days. Exactly like the old days. You guys remember the old days in the 1940s, 1930s, 20s, where back in those days, people would actually have the doctor come to your home.
Yep. And then I started doing some research, and I found that rich people or people with resources have been doing this for years. They have the direct phone number. They can get them on the cell phone right now. If they sick, they can get them over to the house, fix it, whatever, take care of business, and it's a direct connection to the doctor. And so rich people have been outsourcing and ain't even fucking with insurance. This is what I've been trying to tell y'all. Look, we perish for a lack of knowledge. And so when I started to try to spark your curiosity, when I was over there in La Jolla last week, y'all sat there and said, no, AD, you're wrong. No, AD, you're wrong. No, AD, you're wrong. No, AD, you're wrong. No, I'm not wrong. I've done my research. And so the primary care physicians hate how many clients they got to see, and they hate the fact that they got to fight with the insurance companies to get paid way after they already see you. They even hate the fact that they got to deal with all of the paperwork that come with the insurance companies. They hate it. The only thing that they want to do is the initial consultation where they get you into the system, and that's where they fill you out. Your name, date of birth, if you have any pre-existing conditions, shortness of breath, all of that other dumb shit. They put that junk in there one time, and they only want to come and kick it with you.
I just told you guys as well that this is the new direction that you guys need to get into, which is you're targeting wealthy clients, rich clients that are already used to doing stuff like this, where they have their own doctors and stuff. So imagine if you partnered up with, these doctors that work in these neighborhoods, in these wealthy neighborhoods. You partner up with them and you say, please, can you refer to me one of your patients? And then I'll make sure I deliver the services that are up to par with, the quality of work that you're doing as a doctor. That's another niche as well. That's another way to get those wealthy clients. And if you're ready to learn more on how to reach out to wealthy clients through, methods like networking or online marketing, because everybody's on their smartphone now. Everybody's on this device now. So if you can figure out how to get the attention of the wealthy client that needs a home care agency, a caregiver, to come to their home to take care of them personally, right, through online channels, you can convince them to pay out of pocket, just like what these doctors are doing. You know, insurance is not working for a lot of people, guys. All right. So I will stop this video right here so you guys can go watch more. Please go watch the rest of this video. I understand that if you're ready to work with the best, schedule time. I put a link in the description of this video. Talk to you soon.